is facing a growing crisis of diabetes and obesity. Ozempic is dominating global conversations.
Ozempic is a brand name. The magic molecule is called semaglutide.
Yeah.
In India right now, the leading cause of blindness is diabetes. Right now, diabetes is one of the major causes for kidney failure.
A lot of celebrities are rumored to be using Ozempic for weight loss.
You wouldn't feel like आज मुझे छोले भटूरे खाने हैं.
Okay.
You know, but if you do sit down and have chole bhature, maybe ek bhature ke baad you'll be like, I'm done. Also reduces your capacity to have the food.
Medicine to lose weight. Is that safe or not?
There would be risk associated. I'm not saying it's an absolutely safe drug.
Welcome to India TV. I'm Shivangi and you are watching HealthDNA. Well, India is facing a growing crisis of diabetes and obesity. And at the same time, one drug, Ozempic, is dominating global conversations. Now, while some see it as a breakthrough, others are rushing into it without fully understanding the risks. Now that Ozempic is available in India, curiosity has turned into demand. But there are many questions related to it. Who should really take Ozempic? Who should stay away? And how safe is it really? So to break it all down, we are joined by Endocrinologist Dr. Setu Gupta. So welcome to India TV.
Thank you so much, Shivangi, for having me.
And as I said, Ozempic, it is actually dominating global headlines, but for various other reasons. But I want you to first, clarify to our viewers what exactly is Ozempic and how it helps in managing diabetes.
Alright, thank you for the question, Shivangi. So, Ozempic is a brand name.
Okay.
And it has become a global brand name. So basically, the molecule, the magic molecule is called semaglutide.
Yeah, I was about to come on that as well.
Yeah. So semaglutide was manufactured by Novo Nordisk, and as a diabetic drug, semaglutide is known as Ozempic, and as a weight loss drug, it is known as Wegovy.
Okay.
So it's the same molecule, but just different indications and different dosing depending on how we want to use it.
And how it helps in managing diabetes?
Oh, interesting question. And I would say in the past decade, because it's almost gonna be 10 years since Ozempic has been available to us for clinical use, it has changed the landscape. So basically, before Ozempic, we had similar drugs in the market which worked similarly. So if I would break it down for your viewers, Ozempic or semaglutide is GLP-1 analog. What it means is that we have GLP-1 receptors in our body, which are present in our brain, which are present in our gut, which are also present in pancreas. Now, how it manages diabetes is that this GLP-1 tells our brain that you are full. So they don't eat that much sweet. It tells our intestine, it tells our gut that you are full. So if you try to overeat, you may feel pukish.
Okay.
And then also it tells our pancreas that you need to readjust the insulin and glucagon ratios in your body so that sugars are controlled. So basically in diabetes, insulin resistance is there or insulin deficiency is there. But with GLP-1, the insulin tends to be produced more, and glucagon, which increases glucose, tends to come down. So basically it rebalances the hormonal milieu which we require in diabetes.
And semaglutide, as you're talking about it, how is this different from older diabetes medicines that we had?
So if I talk about other class, so we have different classes, like we have a drug called metformin, which increases the action of insulin at the cells. When we talk about other drugs like dapagliflozin, it causes release of insulin from the body through the urine. Then we have other drugs which causes potential increase in secretion of insulin. But GLP-1 tends to work in a very different way. It tends to realign the body, realign pancreas to do what it was supposed to do in a normal state.
Okay. And how does a patient often need to take it, and is it an injection or is it a medicine? Could you please clarify?
Okay, so when we talk about Ozempic, which is what our today's topic is, it comes in the form of injection.
Okay.
And they need to take it once a week. So that's for Ozempic. But semaglutide is also available in the form of pills that a person can swallow. So it's just like any other pill that they have to take daily. So semaglutide is available in both the forms.
And how does this injection work inside the body?
Similarly, you inject it, after a while it gets absorbed and then it gets attached to a protein called albumin. So because of this, there is a big store which is in the blood, and gradually it keeps on releasing for a week. So it just works like if you ingest it orally, it also gets absorbed. If you inject it, it also gets absorbed. So the mechanism will remain the same whether you inject it or ingest it.
Okay. And is it a short-term course or a long-term treatment?
It depends for what you're using. So if you're using it for diabetes, then it's gonna be for long term. Malab, it can even go on for life, because it's just like any other diabetes medicine. Once you start it and once you are doing well on it, there might be adjustments there, here and there. We may feel like reducing the dose, we may feel like increasing the dose, but practically for diabetes it goes on for life. If you're taking it for weight loss, then we can stop it after a while. We can consider stopping it, yes.
I'll come to weight loss in our next segment, but before that, I want to, inform our viewers about Ozempic first of all,
Okay.
the drug used to maintain diabetes. Because let's stick to it first,
Right,
about the
fair
main
enough.
facts. What tests should be done before starting this drug?
For diabetes, we do all the tests that we want for diabetes. So we would look at the liver levels, we would look at the kidney levels, we would see what your HbA1c is, how your sugars are doing, how your cholesterol is doing. So all those basic tests that we do for any and all diabetic patients is what is required. But then apart from it, particularly for Ozempic, what we particularly require is maybe having a look at your heart, seeing if your heart is functioning well, because Ozempic has benefits for heart which we can discuss later on. And also we want to look at the eyes, because diabetes per se tends to affect eyes, and that's why in India right now the leading cause of blindness is diabetes. So Ozempic, there are data which have shown that if the eyes are already affected and they take up Ozempic, there can be worsening of this. So that's why we clarify first, we get a screening done, we look at the retina and we see if there is diabetic effect on the retina or not. If they are not, then we can go ahead for Ozempic.
And how often does the patient needs to be monitored for that?
For diabetes, we call them up monthly for at least first 3 months, and then depending how they're doing, we can even make it 3 monthly. So it's very variable, it's very individualistic.
And coming back to your heart one, the thing that you said that it helps in protection. How does Ozempic help patients who already have a heart disease or they are at a higher risk of cardiac arrest?
Right. So Shivangi, basically Ozempic helps in controlling of diabetes. It causes weight loss. It also causes reduction in blood pressure. It also causes improvement in cholesterol. So all of these 4 things are actually the major risk factors for diabetes, and a single drug can act on all the 4 pillars. On top of that, we have large number of patient data that we have seen that for a diabetic person with the same control, when they were giving Ozempic and when they were not giving Ozempic, and they were followed up for 5 years, we found that patients who were on Ozempic actually had lesser risk of subsequent heart attacks at, let's say, 3 years or 5 years. So actually the risk was significant, 26% reduction. So 1 out of 4 patients are going to benefit relatively.
That is a positive news.
That's amazing news. So that goes beyond the sugar control. It actually has other pathways by which it helps protect the heart.
And is it suitable for newly diagnosed diabetics or mainly for long-term patients?
No. It's a very good drug for newly diagnosed diabetes. Especially, let's say, if somebody is a young person, let's say 35 years, and is obese, and they come to me and I start them on Ozempic. There are so many times after 6 months they are off all medicines. They are even off Ozempic, because we've managed to help them cause weight loss, which has caused reversal of diabetes. So for them it can actually be a
miracle, I would say.
Yeah.
And how does it reduce the risk of heart attacks and strokes in diabetic patients?
Like I said, it causes reduction in glucose, reduction in cholesterol, reduction in blood pressure, reduction in weight, and then a direct effect. So even at the level of blood vessels, we found that it kind of has a lot of anti-inflammatory effect, and it has a lot of anti-clotting effect, because of which the clots in the heart also tends to not progress.
So that's also a good thing for
wonderful
our body.
news. Yeah.
But I've also heard about protection of the kidney.
Yes.
How is it related? How Ozempic slow kidney damage?
So in diabetics, like I talked about blindness, even right now diabetes is one of the major causes for kidney failures. And it's actually the majority, it's the primary cause for patients going on dialysis in India right now. So Ozempic protects kidneys by, again, the same mechanism, causes reduction in glucose, sugar, blood pressure, cholesterol, and your weight.
It works both ways, for both heart and kidney as well.
And further, again, just like we found when we put patients on Ozempic, we found that over the span of 2 to 3 years, their kidneys were protected as compared to those who were not on Ozempic. So it protects kidneys, it protects hearts.
Well, that's a nice thing. And it also helps patients who already have early stage chronic kidney disease as well?
Absolutely. So like if I find a diabetic patient who has early stage chronic kidney disease, I would try to put them on Ozempic provided they are able to afford it.
So is this benefit unique to Ozempic or common to similar diabetes drugs that we had?
Oh, it's similar to all diabetic drugs. So yeah, I wouldn't say it's unique to Ozempic. It works with majority of the drugs that are now coming in the same category.
Okay. Now moving on to our another segment, as I said, that we'll discuss later on, which is related to weight loss, Ozempic and weight loss. A lot of celebrities are rumored to be using Ozempic for weight loss. So how it helps in losing weight? As you said that, it gives our brain the signal that we are full. So that's the main methodology on what it works?
Kind of. I would say that is the major part by which this drug works, but also it acts at the level of intestine and tells the gut also that it's full. So it's not just the cravings which get reduced, but even when you start sitting. So first of all, it works like you don't get the desire to eat that much. You wouldn't feel like aaj mujhe chole bhature khane hain.
Okay.
But if you do sit down and have chole bhature, maybe ek bhature ke baad you'll be like, I'm done. So it also reduces your capacity to have the food and the desire to have food. And then there are smaller pathways, like it acts at the level of the fat cells also and increases the burning capacity of it, so to put in a very layman word. So there are other pathways also, but these two would be the major ones.
It works both ways for that ways.
Yeah.
It gives our brain also the signal that we are full, and it helps us reduce our appetite as well, and also helps in burning the fat.
In a way, yes. It increases the blood flow to the fat cells and increases the burning capacity of the fat cells in a way.
So it works. But right now, as I got to know that it has been approved for type 2 diabetes. Is it also available to take for weight loss in India?
Actually, Ozempic or semaglutide, I would rather say, semaglutide was approved for weight loss 6 months prior by the name of Wegovy.
Okay.
So Wegovy has been available in the Indian market since I think July 2025, and Ozempic, which is the drug approved for diabetes, just got available in India like 4 days back.
So there is a drug only for weight loss, and that also works on the same element that we had.
Yes, it's actually the same drug. Actually what happened was that when they made semaglutide, it was mainly for diabetes.
Okay.
During the use for diabetes, we realized people are losing a lot of weight. So then the parent company also decided, let's explore it as a weight loss drug, and then they found that yes, even in non-diabetic person, it's causing a weight loss and everything. So now it's even approved for weight loss, it's even approved for fatty liver, it's even approved for cardiac protection. So even a non-diabetic person who's had a heart attack can also use semaglutide for protecting their heart further on.
But is the weight loss healthy and sustainable? I mean, we often, face that risks. Or if I would talk about myself, I'm scared. I do not know if I should go for a medicine to lose weight. Is that safe or not?
Do you fly on planes?
Yes.
Is that safe?
Well, it has its risks as well.
Ahmedabad showed 100% mortality.
Yeah.
Would you not fly on plane anymore?
No, I have my flight tickets booked for coming months.
Why are you doing that if it's not safe?
Okay.
So what I would say is that every drug will have side effects, will have risk. Paracetamol, for example, causes liver failure. Yet you
often take,
you don't even think about it.
Dosage in a day very easily.
Absolutely. I mean, if you look at the UK data, the biggest cause for liver transplant in a younger setting is always paracetamol poisoning. right? And it's not poisoning that they've taken pills, it's just a side effect of paracetamol that they've taken over the counter, yet we don't think about it. So answering your questions, there would be risk associated. I'm not saying it's an absolutely safe drug, but in a hand of an expert and somebody who understands the risk and who can monitor you, it's as good a drug as any.
But is the weight loss sustainable, or will it rebound after we stop taking it?
That entirely depends. So it's like asking that you going to a gym, you losing weight, and then asking the trainer that is it gonna sustain. So the only answer they'll say is that either you keep continuing working out, and so it's gonna be sustainable, or you keep taking the drug.
So people have this question as well that, you know, with one medicine only they can reduce their weight. They do not need to follow a particular diet or exercise for that matter. Is it also true?
No, Shivangi, that I would explain that if we start the drug, then you have 3 pathways by which you can lead to weight loss: by controlling your diet on your own, making sure that you're eating healthy, working out, and taking the drug. If you just take the drug and if you don't do, then you're just reaching your target at second gear. But if you add all the 2 more parameters, you work out and eat healthy, maybe you will accelerate and you can drive to your destination at 5th gear. So the velocity of you reaching your target will also change, and then like you said, the sustainability. So I tell everybody that I may be able to take you to your target weight with the drugs, but then staying there is going to be your responsibility. And if you're not able to adapt a healthy lifestyle during the journey, then reaching the target weight is also not going to sustain. You will always bounce back to where you started off.
So is this Ozempic or Wegovy, as you said, for weight loss, is it also injectable or ingestible both ways?
So Wegovy as of now is injectable.
Okay.
But just 2 days back, US has now approved the oral pill also for weight loss, just 2 days back, but it's not available in India. We are expecting that maybe in 6 months or 1 year, even oral drugs for weight loss will be available.
And for weight loss, what would be the I would say the amount that someone needs to take for weight loss?
The duration.
How often and the duration as well?
So often is the same. It's a once a week injection or a daily pill, and the duration is again very individualistic. So if somebody is not following a diet and not working out, then it might even take them 2 years to lose 15 kgs. Somebody is very diligent, they might even do it at 6 months. So it depends on what they are doing and how much effort they are putting in, and also how their own body responds to this drug. So that's also a very individual phenomena which we can't predict until the patient starts the drugs. We are not able to predict beforehand whether they are going to actually be responsive to it. So I have, I would say around 3 to 5% of my own patients have not responded to these drugs.
Okay, so do you also do any particular tests before putting patients on Wegovy for weight loss?
Yeah, couple of tests we do. We'll have a look at their liver and kidneys, and also rule out whether they have diabetes and check their fatty liver status.
Okay. And what happens if someone with normal blood sugar takes Ozempic just to lose weight? Is it also safe?
Oh, absolutely safe. They never get hypoglycemias.
Okay.
So it doesn't cause any major adverse events. जो expected है बस वही रहता है, उसके above and beyond we don't get anything else.
And what are the most common side effects of taking this?
So side effects are there, and the most common ones is the feeling of nausea and vomiting. Around 7 to 10% of our patients, when we start them on the injections for the first time, feel very uncomfortable, feel the bloating feeling, feel their tummy is full, feel nauseated, and they may even vomit sometimes. But these side effects are usually mild, and they are able to push through it, and after a couple of weeks, like maybe first or second injections, they are then doing better. So it's a short-term side effects, not something that persists for long.
And what is Ozempic neck?
Oh,
that
Ozempic
is one
neck.
term that I got across when I was studying about the same. So Ozempic neck.
So Ozempic neck or Ozempic facies, that is also called, it's just a wrinkling of skins that happens. So suddenly somebody starts looking very old. Okay. I think that's like having a loose skin. Like, if a 150 kg person goes to gym and also loses weight, you find them having loose stretch marks and loose tummy, and they may have to go for tummy tucks and all. So that's a natural phenomena. Our skins tend to lag behind when we lose weight. We are able to lose fat and muscle easier, then the skin gets tightened. And also with age, this flexibility of our skin to adapt to our sizes also goes down. So it's a very natural phenomena, and it's not just attributed to Ozempic. It's not the drug which causes this. It's just the phenomena that if you end up losing weight very rapidly, you will have that.
Yeah.
Before Ozempic, there is something called sleeve gastrectomy or bariatric surgery for weight loss.
Okay.
So people, when they used to do those surgeries also, and they would lose 50 kgs in 3 months or 4 months, we would find them having the same skin. Malab, it's just the fact that you've lost weight rapidly and your body will need time to adapt to it. That's why whenever we start our patients on drugs, we do a gradual weight loss instead of a rapid weight loss. We monitor them, and when sometimes, when we feel that, oh, the person is responding too quickly to these drugs, we actually slow them down. We say, okay, don't increase your dosing. Let's continue on this dose for a couple of more months. Come back to me after 2 months and let's see if we need to increase the dose or not.
Yeah, so okay. So it works that ways. And how can patients reduce the side effects while staying on the medication?
So, couple of tricks. So for example, if they are having a lot of nausea or if they feel a lot of bloating, so we tell them that only eat when you are feeling hungry. Don't eat because it's 9 a.m. and I have to have my breakfast. Like, eat when you're feeling hungry and stop as soon as you start feeling full. Have small frequent meals instead of having a big large meal. So keep having something at 2 hours, 3 hours intervals. And don't take soda because it increases the feeling of bloating. Don't take cold drinks. Eat more of salad so that you don't feel constipated. So little things like these helps with them manage the side effects.
And are there different types of people or categories of people who should be very careful while being on Ozempic? Like, there is a warning that Ozempic can be dangerous for certain people. So who are they? What are those particular categories?
So the biggest one is if somebody has a history of pancreatitis, what we call is some injury to pancreas, or if they've had any surgery of pancreas done. So for those patients, we usually tell them to avoid this drug. Then very rarely, if somebody has a family history of a particular form of thyroid cancer, in those cases also we avoid and we say that don't take this drug.
And can breastfeeding women take it?
No, we recommend against it.
Okay. And what about people with eating disorders or extreme weight loss tendencies? Can they also take it?
So yeah, they can, but until a very strict medical supervision.
And what about elderly patients?
Elderly patients are tricky because Ozempic or any other weight loss medicines also causes muscle loss. And in elderly patients, we are very scared about muscle loss because we don't want them to lose muscle and then, have a difficulty in balancing or taking care of themselves. So we are very careful, and whenever we start in elderly, we always do it with a very low dose, and we don't go up to a very high dose. And we keep telling them again and again that you need to keep working out, exercising, and have a high protein diet.
And what happens if someone stops Ozempic suddenly? Are there risks involved, and will the weight come back again?
Yeah, weight will tend to come back until you've adapted a very healthy lifestyle in the meanwhile. So if somebody stops Ozempic suddenly, obviously after a while they will start having those cravings that they had earlier on, and if they give in to those cravings, they will have the rebound weight gain.
Also, coming to the cost and affordability of this as well, I would first like to ask you, what is the overall average pricing or the costing it would require for a person to use Ozempic either for diabetes or for weight loss? And then my other question is, are there any safer or more affordable alternatives to this as well?
Right, Shivangi. So to answer your first question, Ozempic in India, let's say it starts off with somewhere around 9,000.
Okay.
And I think for weight loss, it may even go up till 18,000. But for diabetes, Ozempic ka maximum dose is somewhere around 12,000, 13,000.
Okay.
So that's a month's cost.
That's a month's
cost.
Okay.
Yeah. So let's say on an average, we can pick up 11,000 for a month would be the cost for diabetes, and for weight loss, it may be even somewhere around 17,000, 18,000 a month. For cheaper alternatives, so Ozempic is going to go off patent in India in March 2026. So I think from 1st April we are expecting cheaper alternatives, and the companies that have come to us to tell us about their product, they are saying that it will be somewhere around 3,000 to 4,000 a month. So yeah, I think in India we're gonna get a very cheaper alternative very soon.
So yeah, affordable options are going to come. But India already has about or over 200 million adults with diabetes. Can drugs like Ozempic change the future? Like, and can they actually bring in great result?
Um, Interesting question and a difficult question. So if somebody comes to me at 35 years, let's say Mr. A comes to me, he's 35-year-old man, he has a strong family history of diabetes and he is obese. He is non-diabetic right now, but he's come to me for weight loss.
Okay.
And I use these drugs to help him achieve a significant weight loss. And in the meanwhile, because the problem with Mr. A was that he would go to the gym, but because he wouldn't see the result, he would give up in 2 months. Now with these drugs, I helped him see the results, because of which he got motivated, because of which he started persistent with his gym and exercise, because of which he lost further weight, and then he became even more conscious because people started complimenting him. So he started eating healthy and he started going to gym regularly, and he lost, let's say, 20-30 kgs. Now with this scenario in mind, had I not helped him lose weight, Mr. A might have become diabetic at 40 years and he might have had a heart attack at 55 years.
Right.
But because at 35 I managed to help him lose weight and he persisted with the weight loss, he actually became diabetic at 55 years and had his first heart attack at 80 years. So it has the potential to change the landscape. It has the potential to aid in curbing the exponential growth of diabetes that we have, but it's not an easy solution. Ultimately, the person who's sitting across me when I'm giving a consultation has to realize that diabetes is a lifelong thing and he needs to be at a place where he can make changes which are going to persist for lifelong. Because you've asked a very relevant question, sustainability.
Yeah.
So the sustainability has to come from a person. And the other thing I would say is that instead of us talking about these drugs, when we talk about curbing the growth of diabetics in India, I think we need to go back and actually start looking at what is happening at childhood. I mean, if you look at the amount of junk food our kids are eating and the lack of activity they are having, that is, us focusing on that is going to be much more helpful in the long run rather than focusing on drugs. Prevention has to be there. These drugs are treatment. We've already lost half the battle if we have to start somebody on Ozempic. I used to go out and play during my childhood days. I see at least 3 to 4 obese kids who are less than 16 years with BMI of more than 40.
Yeah.
Because they are just playing at video games, computers, mobile, or tuitions.
Yeah.
No playgrounds, no activities, nothing, and then they're eating junk. Everybody has Zomato and Swiggy downloaded on their phone. The parents have put their credit card. They feel like ordering a momo and they've ordered it. So I think that is more dangerous than the solution that we have as Ozempic.
Yeah, that is, and that needs to be addressed as well. As parents, as people, we have seen, for example, in my childhood, our parents would say that you should have junk food, but once in a week.
Yes.
Now I myself, I often go and have junk food, like it's not a good example, but yeah, things have changed. Our lifestyle has changed. We do not get much time to go back and cook. So yeah, I understand, okay, my lifestyle has changed, but I also have to make changes to bring that back on track.
Absolutely.
Like eat healthy, go to gym and be consistent. Being consistent is the key.
Yes, sustainability
Right.
comes only with consistency. It can't be a shortcut like Ozempic.
Right. And as we were talking about obesity as well, with obesity numbers also expected to triple by 2050, are these injections or drugs like Ozempic, Wegovy, are these part of the solution, or they'll just act like a band-aid?
I think they'll act like a band-aid. I mean, we have to prevent the injury rather than covering up the injury. I would rather have kids play out and have real injuries and put band-aids rather than growing up and taking these as band-aids.
Yeah, so that is a very important thing. But also I would like to clear some statements as are they myth or fact. Okay, so I'll just say a statement and you have to clarify if it is a myth or a fact. So first statement is Ozempic causes muscle loss instead of fat loss.
No, so it causes both muscle loss and fat loss.
Okay.
The ratio usually is 2:1 or 3:1. So if you lose 10 kgs, maybe you might be losing 2.5 to 3 kgs of muscle with 6 to 7, 8 kgs of fat. So it causes both. What we want is fat loss.
Yeah.
So to prevent muscle loss, the person has to eat a high protein diet and has to work out. Without resistance training, muscle loss is inevitable. And that is with anything. If you go on crash diet, if you go on keto diet, if you go on intermittent fasting, you will lose muscle and fat both.
Right. And is hair loss guaranteed when taking drugs like Ozempic?
No, I think it's a myth. It's a big myth. It's blown out of proportion. What the published data says and what even in my clinical experience I've realized that hair losses to the tune of around 5 to 8%.
Okay.
So not everybody have hair loss.
And many people feel Ozempic is an alternative to diet and exercise for reducing weight.
It's complementary to diet and exercise. It's not an alternative.
Okay, so that is one big myth I think that you have busted, because I myself, I was confused if Ozempic is actually the true solution or not, and if I go on Ozempic or Wegovy, so will it help me reduce weight like without even going on diet or exercise? I was quite hopeful if I would if I would have not gone on exercise and used Ozempic, but now that you've clarified.
But Shivangi, you will lose weight, but you will lose weight slower.
Yeah.
And you will gain all the weight back once I stop it.
Once I stop it.
So
that is not going to be the solution
Just
again.
solution.
It is going to be a band-aid, as you said. But thank you, sir. Thank you for clearing all our, questions, for all our doubts. And as for our viewers, what we realize is that Ozempic isn't a shortcut. It is a medical decision, and medical decisions need doctors. They do not need trends. We do not need to follow celebrities who, have tend to lose weight drastically without, consulting a doctor for ourselves. So we need to look on that, and a big thank you to sir for helping us cut through the hype with medical clarity today. And for our viewers, stay tuned, because we will bring more such expert-led conversations like this to help you make informed health choices. So stay tuned with India TV.